I'm Nusha Mikhailova, and I'm the Epilepsy and Clinical Neurophysiology Fellowship Program Director at the University of Michigan. Our fellowship is a one-year ACJME-accredited program devoted to assisting trainees in developing expertise in the diagnosis and management of adult and pediatric epilepsies through implementation of different neurodiagnostic modalities. We offer training in electroencephalography, corticography, decision-making in all types of epilepsy surgery, intraoperative and extraoperative mapping, intraoperative monitoring, understanding imaging and cognitive modalities, as well as medication management. There are opportunities to teach and several basic science mentors with exciting research projects. Interested trainees may elect to do a second year of Advanced Epilepsy Fellowship for additional clinical training or mentored basic science research, and are provided with opportunities of attending formal courses on medical education. Fellows receive outstanding teaching from diverse faculty who have put together a comprehensive didactic schedule. Nonetheless, we're putting a great effort into managing the workload with careful attention to fellow satisfaction. Your application to the University of Michigan is an application to one of the best fellowship programs in the country. We teach you expertise and professionalism, all while being immersed in a bustling and energetic environment filled with diversity and amazing people. We are excited to help you further your career endeavors, and we hope to have you at the University of Michigan. Go Blue!
Hi, Nusha's asked us to speak to you a little bit about the Epilepsy and Clinical Neurophysiology program at Michigan. I have the distinction of being the oldest epileptologist on the adult side or on the ped side at Michigan. And I'll tell you that I did my fellowship here more than 30 years ago. Not to give you the idea of we're very inbred, we are actually not. Our faculty is trained at Stanford, Columbia, Mayo, lots at Penn, lots of different places, so you'll have a nice cross-section of people's view of things. Really, the strength of the program is that we function very much as a team, both clinically and in terms of your education. Michigan is very focused on being an educational program in general, and epilepsy is a big part of that. We're hoping when you come here that you'll be able to share with us what you want to do with this education, and we're hoping to get you there. Give you an idea where that is. One of our fellowship graduates was president of the American Epilepsy Society. A lot of them have started epilepsy surgery programs around the country or become educators themselves at academic programs. And also a decent percentage of our graduates that we're just as proud of have gone into practice and are taking amazing care of patients. Whatever it is that you need to get out of this fellowship, we aim to help you get. I want to welcome all of you, and I want to say I'm looking forward to hopefully working with a bunch of you in the years to come. Good luck.
Hello, Epilepsy Fellowship applicants. My name's Louis Dang, one of the pediatric epilepsy faculty. I also did my fellowship training at U of M. I think there are 4 reasons why you should do your fellowship at U of M too. One is that we have excellent teachers on both the peds and adult sides that really care about the fellows' learning. 2 is we're clinically busy, so there'll be plenty of opportunities to learn, including surgical management of epilepsy. 3 is that there are plenty of research opportunities, both basic science and clinical research, and plenty of our faculty as well as our fellows do research too. And 4 is that our fellowship has a long history of training excellent fellows that become some of the best epilepsy providers in the country. So I really hope you come to U of M.
Hi, my name is Nick Beimer. I'm an adult epileptologist at Michigan Medicine. I am mostly clinical. I spend a lot of my time in the outpatient epilepsy clinic, rotating on the inpatient epilepsy monitoring unit, staffing the outpatient epilepsy clinic where fellows rotate, as well as reading outpatient EEG. I have a specific clinical interest in psychogenic non-epileptic seizures, as well as psychiatric disease and the intersection with epilepsy and neurology. I did my training here in residency and in fellowship, and I stayed on as faculty. The reason that I stayed here for such a long time and for so much of my training really was the faculty here. I think that is the single best part of Michigan medicine. A lot of the mentors that I had in training remain my mentors and now my colleagues today, which I'm really fortunate to have. And I really think that that's one of the strongest aspects of our program, which is that there are such smart and caring people here that would be part of your training should you choose us. So really look forward to talking and hopefully be able to tell you more about it.
Hi, I'm Carrie Neville. I'm one of the pediatric epilepsy faculty here at Michigan Medicine. I did my fellowship here just last year and thought I would show you around a little bit of the resources we have on the pediatric side for the epilepsy fellows. So this is the pediatric EEG reading room where the fellows spend most of their time when they are on the PEDS, EMU, or LTM EEG services. And what's nice is that just outside the door of this reading room is the hallway where most of the pediatric faculty have their offices. Just around the corner there are more offices, and so you can just walk out the door if you have a question about something. And then we also have our EEG lab that is right across the hall from the fellow EEG reading room. And if we come in here, this is our EEG lab where our wonderful techs work. And we have a great relationship with all the EEG techs here, both on the adult and ped side. That's one of the strengths I found of this program, were all the people that you work with. Again, both on the adult and pediatric epilepsy units. And I really enjoyed my time here, so I'm glad that you're looking at Michigan Medicine for your fellowship, and we look forward to meeting you.
I'm Chloe Hale. I'm an adult epileptologist at the University of Michigan. In addition to clinical care, I spend a lot of my time doing health services research with a focus in improving quality, access, and value of care for patients with epilepsy. I think our program is an outstanding place to do fellowship. We have a busy and sophisticated epilepsy service, and you would be exposed to a wide range of clinical presentations and treatments. There is impressive infrastructure and expertise in research. And lastly, I think you'll find friendly and passionate colleagues. I hope you'll very seriously consider our program for your fellowship training.